Labetalol serves as a powerful combined alpha-1 and non-selective beta-adrenergic blocker, making it a critical medication for paramedics dealing with hypertensive emergencies. Its dual mechanism of action allows for effective blood pressure control by promoting vasodilation through alpha-1 receptor blockade, while simultaneously decreasing heart rate and contractility through beta receptor blockade. This unique capability reduces systemic vascular resistance without triggering reflex tachycardia, offering a balanced approach to managing elevated blood pressure. In paramedic practice, labetalol is indicated for several urgent scenarios, particularly hypertensive emergencies characterized by a systolic BP exceeding 200 millimeters of mercury or a diastolic BP surpassing 120 millimeters of mercury. Additionally, it is instrumental during acute ischemic strokes when a significant reduction in blood pressure is paramount to protect cerebral perfusion. The medication also plays a vital role in managing critical conditions such as eclampsia, preeclampsia, and postpartum hypertension, ensuring patient stability in high-pressure environments. However, the use of labetalol is not without its contraindications. It is crucial to avoid administering this drug to hemodynamically unstable patients or those with severe asthma or a history of bronchospasm. Patients experiencing cardiogenic shock, marked bradycardia, second or third degree heart block, severe heart failure, or hypotension are also unsuitable candidates for treatment with labetalol. This underscores the importance of thorough patient assessment prior to administration. When it comes to dosage and administration, labetalol is typically given as an initial IV dose of 10 to 20 milligrams slowly over 1 to 2 minutes, with the option to repeat every 10 minutes if necessary. The total maximum dosage in pre-hospital settings generally ranges between 150 to 200 milligrams. Continuous IV infusion may be initiated in a hospital setting to ensure precise control of blood pressure. Careful monitoring of blood pressure and heart rate is vital throughout this process, and medical providers need to be alert for any adverse reactions, which can include bradycardia, dizziness, or bronchospasm. Overall, labetalol remains a pivotal medication in the toolkit of paramedics, facilitating the management of critical hypertension and providing life-saving interventions in emergency situations. By adhering to established protocols and maintaining vigilant monitoring, paramedics can leverage the benefits of this medication to improve patient outcomes in high-pressure scenarios.